Dr. Griffin, Joya Griffin, if I can call you Joya, which
Yes,
I think
absolutely.
is a very appropriate name after getting to know you. You bring a lot of joy to this table. I'm going to jump right in. I'm a believer that there's three most important days of your life. Day one is the day you find that why, your calling, as you say, where you can find purpose. The day you do something about it, maybe the second day. There's a lot of people that know what they want, but they won't chase it. And the third day is, hey, when it's near the end, there's no regrets.
Right.
So I want to go to day one. You seem to be very purposeful. When did you find your why?
I was pretty young, I think, like many aspiring veterinarians. I was a little kid that had a lot of animals, and I felt like I had a deep connection with those animals, and I wanted to spend my life taking care of them. And so I wanted to be a real life Dr. Dolittle. So I think that I discovered that why really young, and then as I got into vet school and had a deep connection to my family pet was when I realized, the world of dermatology and how I could actually transform a patient and, restore the human-animal bond that they have with their pet parent and that connection to the animal by making them look good and feel good again. And so that's what got me into dermatology.
So I'm going to go deeper, get a little more vulnerable here to say, hey, there must have been some moments along the way where you said, it was that pet, that experience. Because, tell me a moment or two that shaped you, where you saw the purpose of the profession.
I was really fortunate early on to have a lot of vet mentors. I lived across the street from a veterinarian, which never happens anymore, really. But he was
and his name?
Dr. Ballou.
Okay.
And if he's out there, that'd be really great for him to hear this. But he lived across the street from me. He was also my 8th grade science teacher. He worked as a vet in the evenings and on weekends, and he served as a mentor for me early on. So I saw firsthand that the job was possible for me, that I could also do this, and he was very supportive of me as a small child. And then there was another black veterinarian in Dayton, Ohio, who was friends with my dad. We took our pets to him, and just being able to see those two examples up close, I think really helped to inspire me and kind of keep me on track.
So you walk into a vet clinic as a child, maybe for the first time. Tell me what happened, what you experienced.
I remember in Dr. Ballou's clinic, it was literally in his basement. And so he would just come downstairs, meet you there, say your dog is vomiting in the middle of the night, he would be there. And I just loved that care and the accessibility and how, how he was able to balance his day job as as a science teacher with being a veterinarian at night. I thought that was just so special. And he was just so available.
Yeah. So there's this pet owner, the pet, the vet. Tell me about that dynamic and just what happens. And I know everyone's different, so I'm not trying to generalize, but there's a lot of things happening when you have a pet owner coming into a vet clinic and a veterinarian. Tell me about that.
Yeah, I think I kind of joke sometimes and say, when I'm meeting a new client or a new pet parent and their dog or their cat, it's what's behind door number one. Like, you never know the anxiety, the concern, the limitations. You really don't know what they're going to be holding on to when you come in there. And so whenever I go into that exam room, I'm really trying to make a connection with them, one, to build trust and rapport, but also to really understand what's going on with the pet so that I can help them, and to try to figure out what's going to be the treatment plan that we formulate together. So it's not really just about what I want or what I think the pet needs, but what we're going to do in collaboration together. And so I try to build that. And I think good veterinarians are really good at doing that, like building that relationship with their pet parent.
And how does that progress over time? I mean, clients are coming and going, and how do you foster that to go deeper?
Yeah, so for me, one of the reasons I went into dermatology was not only the transformation of the skin, but also most skin disease is not healed overnight. So it really allows me to build relationship with people over time. I remember where they go on vacation, where their kids go to school. You know, we actually get to know each other, and sometimes these patients are in my life for a couple years, sometimes 10 plus years, you know, because we're treating atopic dermatitis, which is unfortunately a lifelong disease.
Right.
And so in those situations, like, we really do build kind of a family relationship, you know, and they know this is who I come to for my dog's skin, and really till the end of the days of that patient's life.
Yeah. Okay, we got to back up a little bit of your story, how you got where you did. Tell me a little bit about the moments and parts of your story that get you to where you are today.
So I think it started out really young, and I had lots of animals, a lot. Many
so you had
cats.
parents that were willing to do that.
They were very willing. We had cats, we had a snapping turtle, we had dogs. At one point I had a rabbit, and they just were so supportive of that. Anything that Joya wanted, she got for the most part. I mean, I didn't have a horse, but I had a lot of little critters, and I had a frog, and you know, so they were just really supportive of that. And my dad was probably the most influential in just supporting, you know, my goals from when I was very small. You know, he just pushed me through to that, kind of aligned me with people that could help support me, you know, and he just said, you know, whatever it is that you're going to do, I hope that you have a profession, something that can follow you your whole life. He said, even if you decide to be a mother and you take time off from work, he's like, I want you to be able to come back to your profession if you would want to. So he really kind of pushed me towards that.
I find listening to people that are really casting big shadows and influence a lot of people like you, it starts with those parents.
Yes.
And there's a little bit of that enabling of, you know, today, busyness, the significance of slowing down and enabling a dream.
Yes.
Was there any specific story or time to say, yeah, go for that, try it, do it?
I like to think I came up with this idea, but I think it was from my dad, looking into how pets can lower a person's blood pressure. And so he took me, and we went to an area nursing home, took my cat in there, which they probably wouldn't let you do today, and then just let the residents pet the cat. We took their blood pressure before and after they were petting my cat, and showed that blood pressure would be reduced with that small amount of time. And this was when I was probably in the 8th grade. And, you know, I just saw, I think firsthand then, that animals can have such an impact on human well-being and really enriching our lives. And I knew that personally, but seeing that, you know, it could actually have medical effects on humans was really powerful for me.
Wow. So enabling the dream, but validating it. I mean, we're still working on those kind of studies now, and that was when you were in 8th grade.
That's right.
So tell me a little bit about your family.
So I have twins, Kobe and Carter. They're 7, and I have a 10-year-old named Caden.
Wow, and a husband that's jumped into the profession too, right?
Absolutely. My husband's a veterinary.
Forrest.
Forrest is a veterinary internist, so we kind of match the inside and the outside, which is wonderful because I can pretend I don't know anything about internal medicine and just call him up during the day and ask him to help me out.
So let's go to the profession. We hear a lot about the capacity of the clinic. And I know you're in a specialty clinic, but you work with a lot of independent clinics that are on Main Street America. What's your view today, and where's it going?
We've never been busier. I think that veterinary medicine exploded during the pandemic, which was such a crazy, hard time, seeing patients and pet parents curbside, you know, spending most of our time on the phone as opposed to making that face-to-face connection with people. So I've really loved having people back in the clinic, but it has been very, very busy. And also I think we have a different demand for care now. Pet parents want good quality care for their pets, and they want it pretty quickly most of the time too. And so it just puts a different level of demand. They also want accessibility. They want you to understand their needs and to respond to those needs pretty efficiently.
What makes it sustainable? What has to change? And we talk about the shortage of veterinarians when things, but if you had to say there's a couple things that have to change to make our profession continue to create the service and the quality of interaction with the pet owners and give them solutions and make it sustainable. Give me a couple things.
I think investing in our teams, having staff and support members that are going to be able to help the vets be more efficient is really important. So I think hiring good quality talent to support you in the front of the house and the back of the house. I think, investing in your reception, investing in your veterinary technicians is really important in letting us do the best job that we can for our pet parents.
Yeah. So you hear a lot about visits are down. People want more convenience. I mean, the challenge inside the clinic, the online movement to some of the services. How do we transform the profession as well with some of this technology and these changes?
It's kind of scary, isn't it?
It is.
Think that, I was on the cusp of technology. I grew up before there were cell phones, and I love that. I wish I could take that for my children and give them a little bit of that. But it is going to be interesting how we balance that, and I don't know if I know all of the answers for that. I think that for me as a dermatologist, it's really important to see my patients in the clinic. Telemedicine cannot take the place of my veterinary exam because a lot of times you can't see the pet actually. A lot of times you're just speaking with the pet parent. You can't see the lesions. You can't do any diagnostics. So I hope that I won't be eradicated by AI. I don't think I will.
No.
And I think above all of that, people still want connection. They still want connection. I feel like I'm seeing that a little bit more. When we first came out of the pandemic, people were still like kind of in their shells. But now people are looking for ways to spend time with each other, and I think that technology will never take the place of human connection.
I believe the same thing. I know Kevin Costner was here at this big vet show this weekend, and I thought his 2 or 3 minute testimony on the moments that matter inside a vet clinic when there is nothing more cherishing than your pet and what that veterinarian does. I mean, connection is the ultimate of the product that you produce, right?
Yes.
So you've done something that you've seen as a trend. Mentioning trends in the industry is specializing. So you made a decision, and I was sharing earlier, as a dad of 6, trying to get into a dermatologist on a family side for our own needs is almost impossible.
Yes.
And it's exploded on the human side, and we always say, hey, what happens in the people side typically happens in the animal side, and as pets get older and we continue to want a higher standard of care, we're seeing these big areas in animal health. And dermatology is definitely one. Veterinary dermatology has exploded.
Yes.
Tell me more about how you got into that, and then tell me a little bit about being a specialist in this area.
Yeah, so as a undergrad student, as a child, I really knew nothing about specialty medicine and veterinary medicine. I thought I was going to be that family vet that lived in the basement of my house. Like, that's what I assumed. That's what I saw. And so that's what I knew.
Yeah.
And then when I went to college, I went to Johns Hopkins. My dad replaced me with a dog named Gizmo for my sister. He came home with this dog, and she became our family's pet, but she had terrible skin disease. And to the point where our groomer told us that we should euthanize her. She lived in an e-collar for over a year.
Wow.
If she came out of the e-collar, she would scratch her face until it bled. She smelled terrible. And, at the time, our family didn't have the means to really be consistent with her care. And also, we didn't have the technology in dermatology that we do now. This was back when, and this is going to really age me a bit, back when you might have to bomb your basement if you had a flea infestation. We really didn't have good flea control. At the time, I think we had maybe steroids and cyclosporin to treat the itch of atopic dermatitis. So she was in a world of hurt. And when I got into vet school, I stole her from my sister, and I took her to Cornell, and the first thing I did was make an appointment with the dermatology service. So I remember being in that clinic and just being so hopeful that they would be able to heal her, that they would really be able to save her life. And they made such a tremendous transformation in her life. She was able to grow her hair back, come out of the e-collar. She didn't smell anymore. She could sleep in my bed. Eventually, I grew her hair coat out into this beautiful show coat, and it was just amazing to me. And I saw firsthand how a dog looks and feels is really important to the bond that you have with that pet. And really, they gave me my dog back. And so I'm still forever grateful for that.
They gave me my dog back. I think maybe that's your biggest, Gizmo as a catalyst to your why.
Yeah,
why
absolutely.
you do what you do is more important than how or what, because there's a purpose that comes from you and a drive from that purpose. That's wow. To take me, so I'll give my own testimony. I'm a water guy. I like to spend my hobbies on the water and lakes, and I grew up in the Finger Lakes near Cornell. We're both Cornellians, and so I've always had Labradors, and we have two now, a black lab and a yellow lab, and this yellow lab, Lakin, is 6 years old. We spent 5 years. And I think, to your point, the toil of the itching, the rubbing on the baseboards, and we would sit and watch TV, all of us, and we had to put her away or go to bed because sitting and watching TV with her scratching was terrible.
It's terrible, yeah.
And
Painful to
we've
watch.
seen a change with a specialist, with our veterinarian, and with the right therapy. It's changed it. But take me to the problem, to the solution. Where are we on the spectrum of this problem? Where are we? How have we advanced, and where are we going?
Well, since I started in veterinary medicine, and even as a dermatologist over the last 14 and a half years, tremendous cutting edge therapies have come out for us. And I think that we're right on the tip of the iceberg of that. I think we're going to start to explode with more options in treatment and care. When I started, we had steroids and cyclosporin, and then, probably about 4 or 5 years into practice, had, the first Janus kinase inhibitor came out, and then Lokivetmab, and so it's been very exciting to watch. And now we have Zenrelia, which is amazing, and it's really changed the life of many of my patients, even in the last 3 to 4 months. So I'm really excited to have more tools to treat these patients, because I think what people don't always realize is that atopic dermatitis is a multifactorial disease, and there is not a one-size-fits-all approach. There are many different ways that we can treat these dogs, and sometimes treatments that may work for one animal may not work for another. And so I see those cases. I see the worst of the worst.
Yeah. So tell me a little bit about how you work as a specialist inside all the other veterinary clinics, and just a little bit of that relationship with the actual vet medicine community.
Yeah, so we work in a freestanding specialty clinic, so we do dermatology only, and I rely on the pet parents and my referring vets to send cases to us that are needing dermatology care. And so we have a really collaborative relationship with my family veterinarians, because those cases that I treat are going to go back to them for the rest of their care. So I'm not keeping the cases. I'm just treating the skin, and really I'm not skilled to treat the other parts of the body.
Right. Tell me about, we talked about the trend and the demand. How big of a problem is this, and what kind of demand do you see out there for? We talk about the number of dogs, 17 million dogs in the United States that have it, 6-7 million maybe are untreated. What do you see in terms of the trend of?
They say statistically about 50% of dogs that present to the family practitioner are being seen for skin disease or ear disease. So it's a large percentage of dogs are coming in to the family vet with some sort of skin or ear problem. And then a great percentage of those, if they're not treated well in the beginning, or if the patient has a more complicated disease or more advanced disease, those are the cases that are often sent to referral practice in dermatology.
Yeah. Anything else as you look to the future of needs, even back on the canine side? Is there things that you say, we need this?
Yes, yeah, we need more targeted therapy for sure. There's this concept of endotypes, and that's kind of the idea of a person having a specific set of clinical signs and inflammatory mediators that make up their skin disease, and they know about that in human medicine. We don't exactly know that and have that defined in atopic dermatitis in dogs, but if we did, that would probably allow me, if I had a patient that came in, I could run a test and maybe be able to determine, well, this is what this dog's allergic profile is made up, which inflammatory cells predominate, and then I can know which drug to use to help to prevent that inflammatory cascade. So that would be really, really cool, because right now we're kind of just picking and choosing from the tools that we have, which thankfully we have more tools, but
Right.
it still is a sort of a judgment call on, you know, which dog gets which treatment.
Take me to a case where there was back to Gizmo brought you into this area. Give me a story here recently where you've seen the before and after and the transformation, not just to the pet, but to the family.
Yeah, absolutely. When new drugs come out, people are always like, well, why? Why do we need that? And as a veterinary dermatologist, we need new options because I see the worst of the worst cases, and I see patients that are unfortunately relegated to being treated with steroids. Like that's the only thing that works for them. So I had one case, it's a 13-year-old dog that had presented to us about a year ago, and she had a 6+ year of itchy skin, and it was non-responsive to Apoquel and Cytopoint. Came into us, and we were working to try to figure out, you know, what her true diagnosis was. So we started with a diet trial, which she failed, and continued to itch in spite of, and then decided to try cyclosporin, which she did reasonable on, and I say reasonable because she still required steroids. And this was a family that would not accept good is good enough, if that makes sense. They wanted her not to itch. And so mom really struggled with watching her itch. Her skin was still very inflamed. She still struggled with yeast overgrowth that I was battling. We were doing topical therapy. And so I would call her and we would check in and we would try to discuss tapering the steroids again, and we just couldn't. We couldn't, she wouldn't. And so when I finally had Zenrelia in my hands, I said, this is the case that needs to try this drug. And she has done beautifully. Within a month, completely off of Atopica, completely off of steroids, and just on Zenrelia and her topical therapy, and looking beautiful. And we're hopefully over the next few months, we'll start to see those side effects that were caused by the steroids start to go away, and her to look normal again. So I'm really excited about that.
Take me to the family, because my testimony is similar, right? And it's my story is my 6 kids all come home at the holidays, and they don't know what's been going on, and they're like, it's a different dog.
It's a different dog.
And it was quite emotional for some of them that you know, she's out of this grief. I mean, because that's why you do. I mean, you say a lot about the connection. How was the family?
They are elated. They are the cutest couple, and mom just, you can tell that this dog goes where she goes. Everywhere she is, Curly is there. And so she's watching her every move, and for her to say that she's comfortable, she's resting, she's not chewing, licking, or biting, and off steroids is amazing, because I really didn't think it was possible. I mean, we had worked this case up very well. Mom was very committed to her care, very compliant, comes into all of her appointments as asked, and I still could not get her skin back to where we wanted it to be, down to a normal dog without scratching and chewing and biting. So I'm very excited to see that, and they're thrilled. They're absolutely thrilled.
All right, so one of the reasons I like to share tables is to share the stories, but also the profession of farmers, veterinarians, and we got to cast bigger shadows and bigger circles of influence, and you have done that all the way to Disney Plus. tell me about global TV.
So I kind of had this really cool experience a couple years ago of getting a television show. It's called Pop Goes the Vet with Dr. Joya.
And Pop Goes the Vet.
Pop Goes the Vet. The name's a little hokey, but I love it. The goal of the network was to find a veterinary version of Dr. Pimple Popper. And someone reached out to me, and I said, yes, that's me. I can do that. That's me. And so I kind of bet on myself, and I had some goals in mind, namely to put a face to my profession. I hear every day from pet parents that they didn't even know a veterinary dermatologist existed, that they wish they knew sooner. And so that was really my primary goal, was just to expose the world to a little known profession. I think there's maybe 350 of us in the country, so still pretty small. And because I love what I do, I wanted people to see that, and also to see that it was available for their little gizmos, that it was available for their pets. So that was my initial goal. And then I have children of all ages whose parents have reached out to me saying that you've inspired me to be a veterinarian.
Wow.
And or to go into veterinary dermatology, and it's just been, you know, so rewarding to see that something that I was able to do has been able to springboard children to go into this profession that I love.
Don't underestimate the significance of that.
Yeah.
I mean, your story becomes so many other people's stories. So it's on TV, National Geographic, Disney Plus.
Yes, yes,
And,
you can still watch it. Still streaming on Disney Plus.
Wow, we need to inspire more. I mean, this industry, which we both dearly love, needs more veterinarians. It needs more veterinarians that come into it for the right reason, right?
Yeah.
It's
Yeah.
the purpose of the profession. So, wow. Okay, so I have to ask, I'm a big believer in a table. I think a table is a powerful force, whether you share tea and yogurt or and food, community. You've used a word a lot today, which is connection. So tell me about a table, whether it's on the professional side or the personal side, that is a sacred place to you.
Yeah, so for me, I think it's the exam table, going into that exam room, and you know, you're standing on each side of it. You know, each side of that table, kind of like we are sitting together,
Yeah.
and that's really the first moment that I can connect with the pet parent, where we can get to know each other, where we can understand the needs of their pet, and that table is that first layer of connection, really. So it's really important, and we try to make our cats and our dogs, when they come in, as comfortable as they can be, and also make the pet parent feel comfortable as well. You know,
Yeah.
making the scheduling, the check-in easy, attending to them as on time as we can. I think
Yeah.
that makes people feel seen, heard, and important when you're trying to be efficient
Yeah.
and getting in that room and spending the time. I do utilize my staff as well to
Yeah, I was
be
gonna
that
ask you this.
first connection with the pet parent. So they introduce themselves, they do a little intake with the history, and I think that also builds a relationship with the pet parent and the staff members, because they're going to be the ones fielding the phone calls and concerns when they call back.
Yeah. So at that table, I mean, you got some of your team there.
Yes,
They know the story of the family behind it, the problem.
absolutely. It's
Yeah.
always about a team approach for me.
So if I had to say there's something everyone needs to walk away with, maybe even a word or a bumper sticker that is kind of using Matthew McConaughey's, you know, there's something you deeply want to be remembered for or believe in right now. It may change 5 years from now, but right now, what is it?
I mean, I always remember my dad saying, and I talked a lot about him today, I guess. I always remember him saying that, you know, people will remember very little about what you said, but they'll always remember how you made them feel. And so it's really important for me to be kind and to make connection with people and to spread a little bit of joy. You know, I'm all about experience, and so I'd rather spend time with you than, you know, tell you a story. I'd rather, like, let's go do something. So when you come into town, we can go to Chicken and Me.
There
and
we go.
have that experience, and just, you know, having that connection with people is really important.
Yeah. The story that I'll walk out of here with is from your dad and Gizmo. Your dad inspiring you to say anything's possible.
Yeah.
Here's pat after pat, turtles and so on, to what happens to Gizmo, to you going to Cornell with that dog, all the way to now a Disney Plus show. Don't underestimate the significance of your shadow. We need more veterinarians. We need more female, minority veterinarians. We need people looking, saying, hey, chase something, you know, that's worth much bigger, you know, than ourselves. And I think what you've done, Dr. Joya Griffin, is significant, and you're just getting started. You have a long runway, and your ceiling will be the floor to your kids, and it'll be much, much higher than your dad.
Thank you.
I'm
I
inspired
love
by
that.
you, and I love this industry, and I love this industry because of people like you. You're a catalyst and a pioneer. Thank you.
Thank you. Really appreciate this.
Let's have some yogurt.
Yes.
Yeah.
Cheers.
Cheers.